Hello friends, today I am going to discuss cough of Hyoscyamus. The cough of Hyoscyamus, which is most characteristics, and it is important for remedial differentiation. If we consider a cough of Hyoscyamus, then we need to know about how it developed. It developed because of elongation of uvula. Elongation of uvula, and it hangs down and rests in the on the root of the tongue. Then it, because of that, the inflammation start and coughing start. So Hyoscyamus has major indication like a drosera, uh, aggravation when lying down, ameliorated when sitting up, and of course night aggravation is there. As compared with the Rumex, there is tickling in the suprasternal fossa, which is most characteristic in a Rumex cough remedy. In a Rumex, there is tickling in suprasternal fossa, as well as because of that, it cough start and temperature as soon as patient wants warm air, it feels relief. Rumex feels relief. So Rumex has a major indication, and one of the best indication is that tickling in the suprasternal fossa. Next, come to natramine. Natramine also because of elongation of uvula, and there is mentha piper. Mentha piper is one of the remedy which is slightly inferior to the Rumex, but there is complaint or there is sensation, or patient says that as soon as I take apples, then my cough start reducing. This is one of this point is a major factor when deciding cough remedy.